carpal tunnel syndrome. The carpal tunnel is inside the wrist and through wet tendons go, and there can be a nerve impinged, and they can press onto a nerve, and that can cause the symptoms of carpal tunnel syndrome. That can be when pain, tingling, or numbness at the thumb, the second or third finger, and in severe cases it can also lead then to wasting and weakness of the small muscles at the base of the thumb. The causes, it develops over weeks, months, years. The causes are enlarging of the tendons, so that when the nerves are more pressed, that there's less space, or also that the wrist has something like osteoarthritis, rheumatoid arthritis, pregnancy, or myxoedema, and then also can it come then. What to do? There's said not to do when movement if it hurts, and it can be worse with the pain at night than hanging the arm out. Can be also better, so out of bed the arm hanging, and it is also oftentimes worse at warmer days. And then it is examined. If a person reports it to a doctor, which should be done if it is noticeable, examined, and there are cortisone injections and painkillers, and there's also the idea named in the book of a minor simple operation, which has a good outlook and should relieve of the symptoms. And that all is according to Keith Watkins' Family Medical Advisor book, written in the 1980s on the page 108 and 109. This is no substitute for medical knowledge and also no medical advice. Hi and welcome. I am trying to learn medicine. Today, carpal tunnel syndrome, and after we've done with, we're going to do leg injury prevention training. And if you participate in the leg injury prevention training, then it's very on this. And we're talking about internal anatomy a bit, and this is no medical advice. I'm just trying to read it and to understand. Carpal tunnel syndrome, it's the second time we're reading it. A condition in which one of the nerves leading from the wrist to the hand is compressed as it passes through the carpal tunnel, a space in the wrist through which tendons that flex the fingers also pass. So first we have to say in our presentation, the carpal tunnel is in the center of the wrist and through that tendons go. We try not to make it more specific, explicit. We don't know it exactly just from the text. There's the carpal tunnel and through that some tendons go. And these tendons can press onto nerves in it. One of the nerves leading from the wrist to the hand is compressed as it passes through the carpal tunnel. The pressure causes pain and loss of some use of hand. And when these tendons are pressing onto that nerve, the pressure causes pain and loss of some use of hand. Severe cases can lead to wasting and weakness of the small muscles of the base of the thumb. The disorder mainly affects middle-aged and elderly women, especially those who use their fingers a lot, such as typists, housewives, or pianists. So people who use their hands often, do they say, but maybe it's also the people who feel it the earliest. So we don't know if it comes from using a lot or the other thing. We try not to mention it. The book is from the early 1980s. It seems to be broadly mentioned here, not as if I would have an indicator that lot of use or overuse would cause it, or if it's genetic or something else. So we try to stay away from it. Because if the 7 causes osteoarthritis, myxoedema, rheumatoid arthritis, pregnancy, and also named in one case, it doesn't really sound as if it would be overuse. So we try to stay away from it. Okay, a nerve is there compressed between the tendons and the carpal tunnel and leading to pain and loss of use of the hand. And it can lead to, I don't know why we mentioned the big thumb, but it could be that it is especially at the big thumb or at the thumb, wasting and weakness of the small muscles at the base of the thumb. Symptoms: pain, tingling, and numbness in the thumb, index finger and middle finger of the affected hand. The pain tends to be worse at night or when very warm. Okay, worse when warm. I think they mean warm days, not when the hand is warm. Warm days, when it is very warm, or at night. And it can be pain, tingling, numbness at thumb, index, and middle finger. So we try to say something about thumb. It seems to be that it is when on the top side for some reason, but it affects these 3 fingers and not the other 2. Duration. Firstly, pain and tingling may spread up the forearm, which can also pain and tingling can spread up also the forearm. and clumsiness when attempting fine work such as sewing. And clumsiness, pain, tingling, numbness, pain and tingling upwards, maybe even clumsiness, and can be at big thumb, wasting and weakness in severe phases of small muscles of the base of the thumb, and thumb, index and middle finger, clumsiness, pain. Duration, symptoms may get progressively worse over a period of weeks, months or years. Worse over weeks, months or years. Lasts until a minor operation is carried out to cure it. We're going to look at the end what we can say from that. Causes a gradual thickening of the tendons that pass through the carpal tunnel. The thickened tendons press on the nerve. The cause is the gradual thickening of the tendons. Reduction of the space in the tunnel is the result of other conditions, including osteoarthritis of the wrist, so the whole carpal tunnel gets smaller. Myxoedema, rheumatoid arthritis, and also pregnancy to be named here. Osteoarthritis, myxoedema, rheumatoid arthritis, and maybe pregnancy, and then otherwise enlarging of the tendons, or gradual thickening of the tendons. What to do? Try to avoid movements that cause pain. And pain at night might be relieved by hanging the arm out of the bed. It's worse at night, then maybe pain can be relieved by hanging the arm out of the bed. When you consult a doctor, as soon as symptoms develop. So, consult a doctor as soon as symptoms develop. Prescribe bare pain-killing tablets, and also the idea of injecting cortisone, examination of the hand, and here's been said with a simple operation with a minor, we don't say cut, a minor operation. Okay, we don't say how, just, we never said how, so let's try to remember that they didn't say anything how, just a minor operation, very simple and minor operation will relieve the pressure on the nerve. Outlook good, the result of operation is generally, so prevention none. So we don't say here something about overuse or something, prevention none, known. Here in the 1980s. Outlook good, the result of operation is generally satisfactory. And the result is satisfactory. Okay, we have it all together, that means we could do the presentation, I think. Okay, let's try to make it. Carpal tunnel syndrome. The carpal tunnel is in the inside of the wrists, and through that some tendons go, and it can be by carpal tunnel syndrome with such a nerve in there. It's not such a nerve. Carpal tunnel syndrome. The carpal tunnel is inside the wrist, and through that tendons go, and there can be a nerve impinged. And they can press onto a nerve, and that can cause the symptoms of carpal tunnel syndrome. That can be when pain, tingling, or numbness at the thumb, the second or third finger. And in severe cases, it can also lead then to wasting and weakness of the small muscles at the base of the thumb. The causes, it develops over weeks, months, years. The causes are enlarging of the tendons, so that when the nerves are more pressed, that there's less space, or also that the wrist has something like osteoarthritis, rheumatoid arthritis, pregnancy, or myxoedema, and then also can it come then. What to do? There's said not to do when movement if it hurts, and it can be worse with the pain at night than hanging the arm out. Can be also better, so out of bed the arm hanging, and it is also oftentimes worse at warmer days. And then it is examined. If a person reports it to a doctor, it should be done if it is noticeable. Examined, and there are cortisone injections and painkillers. And there's also the idea named in the book of a minor, simple operation, which has a good outlook and should relieve of the symptoms. And that all is according to Keith Watkins' Family Medical Advisor book, written in the 1980s on the page 108 and 109. This is no substitute for medical knowledge and also no medical advice. I don't know how the first sentence goes. The first sentence is complicated, all three of it also together. Okay, that was now the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will continue with the next thing, medicine. And we're going to work on our third sentence. Let's do it one more, actually. I'm completely not able to follow it. Not one fault, that's a problem. Okay, we'll also do it. If you were here for medicine, you can go directly to an expert of medicine. Then we will continue with medicine again. That was not medical advice. If you stay here and participate in the leg injury prevention training, then it's at your own risk. Have a good standing leg and swing the leg in front and to the side. Other leg, front and to the side. And one leg, and in front and back. And a foot in front and back. And one leg up and to the side, breathe in, middle and down, other leg up, to the side, breathe in, middle and down, leg up, and press right angle of the leg, flex foot, even line hips, stall off the back, and press from the top against the knee and from the side. Other leg. One leg up, hands out, over cross again. Middle hand down, other leg up, and over cross. Middle, over cross. Middle and down. Stand good on one leg, turn over. Down to the knee, over again, and up. Other leg, stand good, turn over, down, over, up. Stand good. And reach always with a big heel to imaginary 90-minute intervals of an imaginary dial of a clock. And with the other leg, 12 o'clock, 1:30, and 3, 10:30 and 9 o'clock, 7:30 and 6 o'clock, 4:30 and 3 o'clock. One heel onto the ground, don't do it if you're pregnant. Lift the heel off the ground, place it again onto the ground. Over here. And stand good on one leg and the other heel up and down. Other leg, the stamp. And over horse, one leg in and out. And the camel, knee up and back. And if you like, the whole leg swing. One more. And change the leg. First leg in and out. And camel, whole body moving. And then the leg swing. Legs to the sides, breathing it on. In and out. In and up. And out. Breathe in and close the legs. And out. That was the leg injury prevention training. I thank you very much and until next time.